Thank you, Dick. It's such a pleasure to be here at such a great location and such a great meeting. I'm going to talk about a survey study that we're doing comparing satisfaction between LASIK and contact lenses for vision correction. These are my financial disclosures. None are relevant for this talk. In fact, this study is funded by the different study sites that are participating in it and the Corneal Research Foundation of America. These are the 20 sites that we have across the United States. These are the people that are funding the program and the people putting the patients into it. Now, the purpose of this study is to compare patient satisfaction with LASIK and contact lenses for vision correction. And it's being done to make a new benchmark so that we can compare LASIK with a popular alternative for vision correction rather than a hypothetical eye that doesn't exist. Now, why is this study important? There's been a recent movement throughout our country, not just in medicine, but everywhere, to compare things to, perfect, perfection that can't be obtained, whether it's manufacturing, general sales. And certainly there's a recent movement to compare LASIK to an emmetropic, non-operated eye without any comorbidity. Now, what's often forgotten is that there's no perfect method to correct myopia, astigmatism, or hyperopia. It doesn't matter whether it's glasses, contact lenses, laser refractive surgery, or not wearing any vision correction at all. You typically have some visual distortions. So the design of this study is a multi-center survey study. It's internet-based. It's self-reported outcomes by the patients, not by the physicians. There's two arms of the study. There's the LASIK arm, where patients take the survey prior to having LASIK, then 1, 2, and 3 years afterwards. And then we have a contact lens arm of the study, where patients take the survey and then are followed up 1, 2, and 3 years later. The inclusion-exclusion criteria are designed so that we can have patients where we can just look at the visual correction itself without too many confounding variables. So it's age 18 to 60, but they do require vision correction. We do not include people with keratoconus, abnormal topography, or multifocal treatments. To date, we have over 1,700 patients enrolled in the study, a little over 1,000 in the LASIK group, over 700 in the contact lens group. And 1,400 of the patients enrolled so far wore contacts at the time of the baseline survey, and that's what I'll be talking about today, are these 1,400 patients, and they're in both of the groups. The demographics are they're primarily female, median age 34, mean refraction or spherical equivalent was 3.5 diopters, ranging from +3 to -11. And 91% of the people in the survey wore contacts greater than 5 years. And the reason is that in the contact lens arm of the study, we only wanted successful contact lens wearers that have been wearing their lenses for at least 5 years, whereas in the LASIK group that was not a requirement. Now, most of the soft contact lenses were soft, half extended wear, half daily wear, very few of the other types of lenses. And we asked them a series of questions. Would you recommend contact lenses to a friend or family member? And this is just to see their general satisfaction with contacts. And we found that 93% of the contact lens wearers said they would recommend them to a family member or friend. And what's important to remember here is that this includes the people having LASIK. And there was really not a big difference between these two groups, so that the people having LASIK would recommend contact lens wear to a family member or friend. They were satisfied with the vision correction they provided. Now, despite this high satisfaction rate, many contact lens wearers reported some vision issues in the baseline survey. We asked them, do you have any difficulty driving at night because of your vision? And we found that about 13% of the people did have difficulty driving at night because of their vision with contacts. During the past week, how often have your eyes felt dry? And we found that over half of the people did have issues with dry eyes while wearing their contacts. How often do feelings of dry, irritated eyes limit your contact lens use? And we actually found that it was 28% for sometimes and 17% for often. Now, while wearing contacts, do feelings of dry, irritated eyes affect your vision? And we asked them, does this affect vision, comfort, both, or neither? And actually, only 26% of the respondents said they had neither problems. and you can see that about half of the people had problems in both of the categories at the same time. Now, dry eyes were more prevalent for limiting contact lens use in the LASIK group. 23% of the respondents said it is often or always limiting their contact lens use. And I don't think that's a surprise to LASIK surgeons, but what is a surprise is that 13% of the people staying in contact still fit into that category. So in conclusion, this study helps set an appropriate benchmark for LASIK. It's comparing two widely accepted treatments for refractive error. And it's important that both of these treatments entail some risk, and both provide a more functional and aesthetic correction compared to glasses. We're sampling a large number of people from across the country, and it's also important to realize that contact satisfaction is high, but it's not symptom-free. This study sets an appropriate benchmark for LASIK, I think, that we should compare it to rather than a hypothetical perfect eye. It's helping us identify what are the most common complaints after LASIK and what are the most common complaints before LASIK. And surprisingly, they're very similar. What are the areas that we need to improve on, I think, are another area that we're looking at. And I think we're coming up with some areas that could really be improved on for contact lens wear and make that more successful as well. We expect to finish our baseline enrollment at the end of this quarter and hope to have over 2,000 participants at that time. And hopefully next year I'll be able to come back and report to you what our one-year results show. Thank you.
Thank you, Frank. Excellent paper. We did a baseline review of the literature a number of years ago with the ASUS AAO study group looking at patient-reported outcomes in LASIK, and that's been published. Most of you are aware of it, 95% patient satisfaction. There also is the PROWL, P-R-O-W-L, patient-reported outcomes with LASIK study ongoing, which is a collaboration between the FDA, the military, and the National Eye Institute. And we'll hopefully have some data from that coming up. But patient-reported outcomes are important. You know, happy patient, happy doctor. So these studies, I think, are very relevant. We're looking more and more at what our patients think, not just at the objective data.